Welcome back to Benchmark. I'm Anshin Salvarajan. Now we're going to take a look at Sri Lanka's population trends, and joining me from Frontier Research is product head Travis Gomez. Welcome back to the show, Travis. Now you all just did this study on the population trends, what were your findings in terms of our population growth?
Yeah, so in terms of the projections, what the forecasters are expecting is by 2040 the population will be about 22-24 million, will be in that range. And actually more recently what's been happening is that there's been an uptick in the number of the fertility rates have been going up, so because that there has been an uptick there as well. So there are like a number of factors why as to why that might be. But overall, even though we are seeing this population growth, it's not really some of the trends are not so positive in terms of, particularly when it comes to these non-communicable diseases, because according to the World Health Organization, about 1/5 of the diseases are NCD. A lot of the deaths are related to NCD. So in Sri Lanka's case, things relating to cardiovascular, diabetes are like the most prevalent things.
Now, Travis, some numbers put out by the UN say that by 2041, our aging population will increase by almost 100%. Now, is Sri Lanka geared towards handling this?
So just to give you some background in terms of aging population, so this is like the usual phenomenon that you see as a country's health standards improve. What you see happening is that the life expectancies increase. So because of that, the people who are above 65 years, who we classify as age, that chunk, that share of the population increases. And currently the projections are by 2040, about 1/4 of the population will be in that category. Apart from that, the other thing that is also interesting to note is that the people who are in the very old category, that's the people who are above 70, above 80, that share is also increasing. So this has a lot of implications in terms of at a macroeconomic level. So if you take like the public expenditure on healthcare, that is going to increase in line with this, because typically what happens is with the aging population, there is more, typically the health expenditure is going to be more, it's more frequent as well. Plus it also has implications when it comes to the pension arrangements as well. So maybe we need to go for like private pensions or these sort of contributory pension schemes. So those are the aspects that we need to look at, and really we haven't as a country really invested in that because there's a lot of there's considerable needs when it comes to these sort of specialized care like the geriatric care and these sort of assisted living, people who can support in that. So at the moment we haven't really, as a nation, haven't really geared towards that.
What were your findings with regards to female labor force participation?
So at the same time that you have this aging population, you also have the population, the working age shrinking. Now, in Sri Lanka's case, we've had, when it comes to male labor participation, it's been fairly high, like in the 75% range. But when it comes to females, even though we've seen this big improvement in the health standards, usually what happens is as health standards improve, as the family sizes become smaller, we tend to see more and more females participating in the labor force. But in Sri Lanka, what we've seen is that actually the female labor participation has kind of been stuck at like this 35% level. So what we are seeing is that so even if you take globally, this is kind of like the usual phenomenon that happens. So because it's a lot to do with sort of structural reasons and cultural reasons why. So usually it's only when you get to like a very developed state of the economy will you see that this sort of big shift happening. There are more females coming to the market. But in Sri Lanka's case, actually there is a case where you really need to encourage this, because because the majority of the population is female and the more educated population is also female. So we are kind of like squandering the opportunity in terms of not making full use of our potential. So if you look at some of the things that even the private sector can do, one sort of big barrier to this is when it comes to the provision of like these daycare centers and things like that. So those are some of the investments, some of the even the private sector needs to look at in order to facilitate.
Thank you very much for joining us, Travis.
Thank you.
That was product head from Frontier Research, Travis Gomez. Thank you for watching Benchmark, and we hope to see you again next time.